lovely friends. We're going to be placing leeches today for a lump on the breast, right? And the patient is suspecting that it could be a tumor. So, we're not sure what it is, but we're going to be placing leeches and see if that resolves the situation. How long have you had the lump?
Well, this lump has been here for a long time. There's actually two, one here and one here.
Oh, I can see it.
Yes. So this is why I don't think it's cancer, because it's painful.
I can see this one.
Yes. So, like, I don't know, 4 years.
Let's see if we can adjust the camera better so we can see what's going on. It's slightly visible now. Okay, so it's been there 4 years. I've had cases where these kinds of lumps have been removed, but they were there only for a year.
Well, I don't think it can be removed.
And
it's big.
she doesn't really like the place.
No, it's because of the pepper. Трябва да се измия. Дай да го спрем и да се изкъпа.
Не. Нямаме време за това. Аз трябва да ходя. Аз съм тук само за слагането им. 12 часа. Те си гоня транспорт до провинцията. Сега. Слагаме и ще видим дали ще се хванат. So we are going to place them. She said she placed hot pepper on her breasts in the hopes that it will help the situation.
То си беше...
However, it hasn't been helpful in enticing our leeches to bite. So we will try and trick them. Hopefully you can see. Можеш ли така да държиш за малко? And we'll put a little bit more leeches under the cap to see if any one of them will want to bite, because they are very, very hard to bite right now. Usually they'll bite immediately, or almost immediately. If it's a young person, it's normally an immediate action. Very difficult to position the phone here. Let's see what's going on. Okay.
Ето едно.
No.
Не.
If you can hold it right there. And we have a whole bunch of leeches that we can choose from. But none of them are willing to do the job.
They don't like the pepper.
No. If you have a needle, we can try and prick your skin. And once they smell the blood, they will, at least one of them should bite. And once one of them bites, then the rest will want to bite as well.
Искаш, може да почнем от начало видеото.
Не, нямаме никакво време. Абсолютно. Трябва да поне една трябва да захапе, за да можем да другите да помиришат кръвта.
Добре, да потърсим.
Няма нищо. За сега така държиш. Дори ако отидеш да търсиш игла, така ще държиш.
Май усещам нещо.
Така ли? Стой тогава. So she thinks she's felt a sensation of biting, so we'll see.
Да, определено.
Good.
Should we try? See.
No, just keep it there. So we're going to be using a pad such as this one to bandage, and the patient has sent her husband to purchase some more pads from the pharmacy. However, he hasn't gone yet, and we're not sure if we'll have enough time to wait for the pads, but then you can use them once they arrive. We'll use these ones meanwhile.
I have some here.
But because the place is so different, there's no really way to attach them except maybe with some construction tape. Oh, great. I also have a leech in my hair. So, because we don't have a real decent way to attach it, we are going to perhaps place a towel in this area.
Yes.
Meanwhile, and do you have a towel prepared once they start dropping off? Also, are you going to save the leeches or
Yes.
let them go?
Save them.
You want to save them?
Again.
Okay, if you're going to save them, you might want to get like a jar with a lid with some water and keep them for yourselves.
Give me a jar with a lid with some water. I mean, they can be used again, right?
Yes, they can be reused in 3 to 6 months. Is this an old towel? Because this is going to be soaked.
Yes.
Okay. So we do have our towel. We don't have a jar for the fed leeches yet, but that we haven't come to that point yet. Okay, so we have no action of biting yet. I don't know what you felt, but it wasn't biting.
Да потърся такова.
Okay, да, може, ако искаш.
Игла.
Къде е игла? Стига да пусне малко кръв. So the patient's looking for a needle. Oh, thank you. We actually need to offload some of this water because they need air to breathe.
Sure.
If you have any questions whatsoever, leave them in the comments. Okay, thank you. And if you have a similar condition or anything that you think leeches might help, let me know. I will comment about your condition, your situation, to see if leeches might be helpful. Leeches also make great pets, so if you have them at home, it's very simple. All you have to do is just keep them in a jar of water and just keep changing the water every week or so. Dump the old water out, put new fresh water in, and the leeches will live for up to a year without feeding. This is what they look like. This is Hirudo verbana. Whoops. Medicinal variety leech. I have some chamomile tea I'm drinking. Леко, само леко ще продупчим. То няма да е дълбоко. Тя пиявицата след това няма да се хване, ако сложа много спирти. Тя няма да се хване, така че сега ще съвсем малко ще сложим.
Също малко.
Я да видим. Let's see what's happening here.
Нищо.
No, nothing.
Усещам просто болката от това. От
Мога ли да ти помоля
натиск.
да държиш така? Да. Добре.
Ти ли ще го направиш?
Да.
Чакай.
Ако желаеш ти, стига да пусне кръв и да не мирише на спирт.
Добре, сега ще го изпуша. Ти ако миризмата на спирт ги притеснява, представя си как люче пипер.
Абсолютно.
If alcohol is bothering them, I can imagine how.
Навътре се
Просто
натиска.
да го пробия.
Натискаш, после изкарваш малко кръв. You're just pricking and letting out some blood. Да ти помогна?
Добре, аз няма да гледам. Ама гледай да не е точно по средата някъде.
Кажи къде искаш.
Еми е тук.
Тук.
Да, някъде там. Тук излиза май малко.
Стесни тази кръв, ако обичаш. We do have a little bit of blood that we're going to hope this leech will smell. And he is getting a bit more interested, seems like. But they're very, very active today, and they're almost impossible to tame and to get them to bite. It's so crazy, and they don't like the location as well. Let's see what happens.
Загубихме ли някой?
Не.
Добре.
Само дръж, ако можеш така. Да мога аз всичко друго да правя. We have a big devil here. Maybe he will be more willing to bite. Okay. Yep. Worst comes to worst, you can always just keep 10 leeches and then put them on yourself at a time when you're ready for something like this. Because leeches don't like perfume. They don't like anything other than sweat. Yes. Cleanliness or sweat, they can latch on. Or if you prick yourself and let out a significant amount of blood so that they can smell it. If they can smell it, they will latch. But this one is very, very tiny droplet. We'll see if they smell it. Thanks for the delicious tea, by the way. It's so good. Let's see. No. Okay. Well, no.
This one.
No, none of them. Okay, so let's try this again. Okay. Where's the needle?
Did we lose it?
I put it here. This is where I put it.
It's over there.
Oh, okay, here we go. So, yeah. Let me try it myself. If you can just hold this like that. No. I'm really afraid to prick someone.
Maybe I should try myself.
Yeah. So maybe try and get it deeper in. In the meanwhile, I'm putting more leeches under the cap. So it's been a real challenge placing leeches on the breast area because of that hot pepper, perhaps. Any luck? No. You have to hear. You have to hear a pop. When you hear a pop, that means you've pierced the skin, and the blood will start to ooze out. No. We can try and put them on without. Let's try again. Now I've really jammed it up with leeches.
Okay.
So let's just keep it pressed like this.
We can try the hands.
Try the hand. You want to try the hand?
Mm-hmm.
Okay. Show me where you want them placed. Okay, hold on. We have a biter.
Yay!
We have a biter.
Does this mean that everyone will bite?
Probably so, yes.
Okay.
Hold on. Release, yes. Oh, good. So one of the big leeches has finally taken on. And hopefully its brothers and sisters will be interested as well. So we're going just to keep them all under here. Okay, now let's try this one on your hand.
Okay.
Is this round about the area where you like it?
It's more here.
More here?
Yeah.
Okay.
It stings. The breast.
Can you keep this one on here? And I will take another cap and just show me exactly where you want it. Like right here? Okay. So we're placing another leech on the wrist. And the caps are a good way of placing leeches on areas because, especially if the liquid from the bottle is something that they hate, because then they get angry and upset and they start biting. The one thing that they hate the most is like nozzle spray. If you take the cap from that, they bite immediately because it's got saline solution, so the salt makes them angry. Yeah.
Whoa.
Yeah, it's a whole science. So we're just keeping that here, and then we're keeping the cap still on the breast because, okay, here we have a second one and a third one. Oh no, just two so far. That's a good progress. It's excellent so far.
I'll hold this.
Yeah, you can hold that one. And we'll place another one under here. We actually use this cap because this cap worked so far, so we're gonna use it. Maybe the alcohol is not a good liquid for them to get angry on. I know the saline works, but the alcohol may not be so good. Okay, so keep your, yeah. Okay, so we have two so far, which makes me think that we can latch on more. Did you want 10 here, or did you want 5 here and 5 on the wrist? Because
let's try 2 more here.
2 more on the breast.
Yeah, maybe lower because there's a second.
Okay.
Ow!
You're feeling this?
Yes.
Yeah, you will feel a stinging sensation for a few minutes and then everything will stop.
Because they're they're sucking.
They're not sucking yet. They're
they're
biting and forming a channel right now.
Oh God.
It will take a few minutes for them to create a good channel to suck from. You see how they hate the spirits so much. They
No,
can't
I
even
mean
stay in the
lower
cap.
than this.
Lower,
Yeah.
right there. Tell me exactly. Right here.
Here, maybe.
Okay.
Yes.
And here on the wrist, we don't have any success yet, so they just keep falling off.
Oh, this one wants to run away.
Did he come out of the cap?
Mm-hmm.
That's why we have to keep the cap pressed. Okay.
Yeah. Don't run away.
Let's see. Yeah, we have to keep it pressed, otherwise.
Ah, there's one here. I thought they would just go and bite.
No,
No.
not every time, because if they don't like the place, or it smells like something, or if sometimes an older person also has a very, very low chance of them biting, because there's no blood circulation, so they can't smell any blood there. But in your case, it's the smell of something.
Yeah. So maybe if we can get it here or here somewhere.
The only way to do that is if you keep the cap pressed, because I'm
Yeah,
pressing
but we
on
gotta
this one.
move this one.
We can't.
We
He's
can't?
holding on. Okay, so keep this one pressed. We're gonna fill up another cap.
Can we move the back?
We can't, because he's right now his teeth are cutting. So for his teeth to cut, his back suction cup has to be very tightly pressed. I can dislodge the back suction cup, but there's no guarantee where he's gonna latch on next. Like this. And then let's see what's going on with the wrist. Do you feel any biting here?
I don't know.
No, nothing. So, since there's no biting here either, we are going to have to prick your wrist. And do you remember where you put the needle?
No.
No,
Oh,
it's
here
right
it is.
here. Okay.
Here's the thing.
So just keep this one pressed. All right. And just tell me where you want it.
I don't know,
Right
just yeah. It will hurt though, so jeez.
Do you want to do it yourself?
No, I'm just thinking maybe here, because here it also hurts. Ah, jeez.
It's gonna hurt you.
Ah.
Or we can keep only the breast today, so you have only one area to control the
Okay.
bleeding from, because
Okay.
it's gonna be
Hard, and then I'm gonna.
hard to control so many areas of
Okay.
bleeding. Yeah.
Yes.
Let's see what's going on under this one.
Oh.
Oh, goody. Oh, okay. He's exploring right now. This one's also exploring. So we have 2 explorers and 2 biters, and the biters are massive, really huge. And the explorers are smaller, but keep this one pressed. I'm going to fill up the next cap. Actually, this one's smaller.
So what does it mean they're exploring?
Exploring just means they're looking for a place to bite. They're not sure if they want to do it yet. They're exploring the area. They're like, do I like it here? Do I want to bite? But 90%, 95 or 99% of the time, if there's brothers and sisters who are already biting, these will bite as well.
This is Yo-Yo. I think. Come on, friend.
Yes.
Let's see what's happening under the pink.
What's up?
Nothing? Hold on. Let me remove it. Let's move this one there. Okay, perfect. So far, we have low success rate of biting, but slowly it's happening, little by little.
What was that?
It's a package.
Okay, I said something.
You felt something? Oh, good.
Yes.
Oh, excellent.
But maybe it's the cap. I'm always wondering.
You see now this one, how he's sectioning? I can actually move this one. Do you want me to?
Why?
Do you want, well, we can get more to bite in that area. Do you want me to move it?
It's fine. I think it's fine because the lump is right here. So.
Is it? Okay, if the lump is there.
No, but I think you could put it here because of the lymph nodes as well.
Mhm,
You know,
okay.
because the lymph nodes go towards the armpit.
Mm-hmm. You see how you have another one? This one. He
Yeah.
wants to bite as well.
What?
He's exploring.
Okay, so I think there's
Okay,
something
we have
happening
another one.
here. Yeah.
We have another one. Good. Okay. Slowly but surely.
The
it's
teeth.
happening. Do you have any other lumps anywhere on the body? It'll
yeah,
go away.
Yeah, on my head.
You have a lump on your head?
2 of them, yes.
Are they similar to this one?
No,
Mm,
they're not painful at all. Why are you asking?
Because I've placed on the head leeches on lumps
These are-
and they go away very quickly.
Well, these are made of, they're very hard. You can touch them. Touch it.
Yeah, I see.
They're
it.
made of fat tissue, so lipoma.
That's okay.
Lipoma.
The leeches will break up any kind of tissue.
Wow.
Yeah.
Well, maybe next time.
Hold on, don't move. Don't move.
I'm
He's
helping
exploring.
him.
No,
No.
just... He will bite though. This guy will bite. He's experienced, he's older, and usually big leeches like that, they bite. They will bite. Just keep it like this.
Okay.
I'm gonna cup another bunch right there. Okay. So we're just gonna keep it like that. Hopefully we'll get more to bite.
I feel a lot of teeth.
We're going for 10. Oh, what a white cat.
Ah, yeah.
She is beautiful. Is it a she?
Yes.
Okay. Has she ever had any babies? She's got
Yes,
blue
yes.
eyes.
3.
Wow.
He has 3 white kittens.
3 white babies. And where are the babies?
They're with friends.
And you've given them away already.
Yes. Oh, it was like years ago.
But has she been fixed since?
No.
Okay, so she can still be a mommy.
Yes. We read that actually it has no sense to fix them later. I don't know if
There's
this will
no
work.
way. There is no way to place it.
Oh
there.
well, maybe if you put this underneath.
No. So it'll still. This is a good place.
Wow, it's so red already.
Mm-hmm.
Wanna check?
Yes, you will get like a dime size or quarter size redness circle.
How long will it last?
With what?
The redness.
While they're sucking.
After that, will it disappear?
Depends. Some people get redness for 2-3 days and others don't.
Okay, because I have doctor's appointment on Tuesday, and they will kill me. They'll be like, "Oh, what are these crazy things you're doing?"
Just tell them I put leeches or something.
And they'll be like, "Are you crazy? You're gonna hurt yourself." Bulgarian doctors are super.
There's no action happening here. He's asleep.
He's asleep.
But we'll get him to bite, I'm sure. Let's see this
Ah,
one. It's okay. Let's see this one.
No.
We have some explorers that are interested somewhat, but nothing really happening. Okay, I'm not so happy about this. I was really hoping for more action. Let's move the location maybe here.
Come on, dude.
No, I'll take him away.
This is too
here.
small.
And I'll put a fresh new batch of leeches.
My son will be so interested.
Really?
Yes.
Is he coming?
Yes.
Oh, nice.
My neck hurts from looking down.
Oh, you can just relax your neck and just don't worry about it. It'll happen. Let me put another one in. Here we go. What's your favorite food?
I don't know. I've changed my diet completely lately, so I'm vegan and I'm trying not to eat carbs. So
So how long have you been a vegan?
4 months.
Did you used to like dairy a lot?
Yes.
Because usually these form from dairy, these types of lumps.
Yeah.
Mm-hmm.
Yeah. I ate a lot of dairy at some point.
I used to get these lumps here, but they were like very small. And I would put 5 leeches on, and in 3 days the lump will be gone.
What's happening?
Yeah, there's several
No, these people.
suckers. They're just hanging on. Their tails are hanging out.
But this guy isn't.
This guy is not, no. He needs to be under the cap.
And this guy too, I
Let's see.
think.
Let's see what's happening here. We have some explorers.
Yeah, guys. Come on.
That's good, that's good. It's good that you're exploring, but you need to bite.
What is the slime?
That's what they secrete. No, we don't want him back here. We want him here, because he's a big one. He knows what to do.
Oh, yeah.
Ah, good.
Stop.
Goody. Oh, I'm so happy. How many have we got sucking, right? 1, 2, 3, 4, 5, 6. We have 6. Nice progress. Let's see this one. Oh no! 7, 8, 9, maybe even. So we're going for the last one. Keep your finger here.
We tricked
Excellent.
them. We tricked them.
Yes, we did. And we thought this would never happen because they weren't biting at all in the beginning. And as you can see, eventually they will bite. So is this the same kind of spirits? No, this is hydrogen peroxide. Oh, I see. So how about I just wipe this off here and return the cap? Are you okay with that?
Yeah.
Okay. We don't need this anymore. I think we have a good success rate. We're gonna count them. The best way to count leeches who are feeding is actually when they start dropping off, because while they're feeding, we don't really know how many there are. Sometimes you can count them, but sometimes you can't. So let's see what's happening. These ones are not doing anything at all. But we have plenty here. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, we just need one more guy to latch on. And I'm just gonna, these are small people, small leeches. They're not experienced. And when they're not experienced, they don't know what they're doing, basically. So,
Oh God, I gotta stop looking.
So that's why we have a very low success rate with small leeches, but big, massive success rate with the big leeches, because they're just wise. Here we go. This one is really exploring in there. Okay, I think he will bite. Yep, I think so.
It hurts.
And what Doris decided to do is to keep them, right?
Mm-hmm.
So she will put them in this jar, which has one. You never should mix hungry leeches with fed leeches. Just
This
so
one
you
is
know.
hungry.
This one's hungry, so I'm
Yes.
putting him back into the jar. Okay, and right now there's too much water, so I'm just gonna go and pour off some of the water, put some fresh water in, and when they start dropping off, we will transfer them into this jar, and where she will look after them for the next 3 to 6 months. When they're ready to eat again, they will start biting again.
Mm-hmm.
So that's how you know that they're hungry. You just keep trying them on, and when they bite,
3 to 5 months.
3 to 6 months.
Okay. I'll just make them really hungry.
How,
Starve them.
yeah, you can. Yeah, they starve. They can go up to 1 year without eating. So we're gonna be back in a little bit to take these off.